You can walk, jog, or sprint to the finish line, depending on which retinol percentage you're going to choose. This is going to give you that little bit of retinol. It's going to keep those cells active, always on the treadmill, always working, always being stimulated. So all skin types can use this, whether you're young, old, light, dark, man, woman, acne, pigmented, it doesn't matter. It's in every single one of Zio's protocols. It actually helps to restore the barrier function of the skin. And that's what you see here. You see two different diagrams. One diagram has these little arrows going up. That's because the barrier of the skin is restored. So no harmful elements get in. It acts like a shield. Whereas on the diagram over here, you're seeing the barrier of the skin's not functioning the way it should. There's no shield there. Harmful elements starts to get in, and disease and things like that start to occur. So this guy here, actually one application helps to repair 8 hours of oxidative stress.
What's it called?
Daily Power Defense.
Oh. Is that the one that you're saying is the most common one?
Yep,
Yeah.
our most popular. But one application actually helps to facilitate recovery.
Once a day?
Well, yeah, just like, yeah, well, we normally like it in the morning, but if it's your only product, you can use it AM and PM. It's not too much to use twice a day. I use it all around my eyes, on my neck. It's totally gentle.
So it just repairs the damage that was already done?
That's it, you bet. It speeds up recovery of damaged cells within 2 hours versus 24 hours, including sunburn cells, too.
Isn't it better to do it at night then?
You'd think so, right? We're going to use a stronger retinol at nighttime, so that's why. So we want to kind of repair the damage from the day. But yes, fair enough. I know what you're saying. When skin's 8 times more active at nighttime too. But that's when we're going to use our big guns. And we're going to use yoga during the day. We're going to do boot camp at nighttime. It's kind of what he likes to do. Although there are some protocols doing boot camp morning and night for really severe.
That's literally what Samantha does every day.
Oh yeah. Oh my gosh. Oh, so you guys, for the anti-aging comportion, there's retinol and peptides. It's firming the skin. It's increasing elasticity. It's reducing fine lines and wrinkles. That's what your patient wants to hear. There's these amazing enzymes that facilitate recovery of damaged cells, like we were talking about, in 2 hours versus 24 hours, including sunburn cells. Then there's antioxidants in here to defend against environmental stress. It's a one-stop shop for your face, and you can use it on your eyes and neck if you want to as well. It's fabulous and really lightweight. You guys all touched and felt it, right? So I spend a little bit more time on that one because it's so great, but we love it for everybody. Actually, I'm going to show you before and after picture. This comes from a clinic in West, and this patient bought what was known as our daily skincare kit. In that kit has the exfoliating cleanser travel size, like the GSR kit here, the polish the complexion has, and the daily power defense. He did 6 weeks with it, and he came back in for his before and after picture. And I'll just show you you'll notice a difference in redness and some of the brown spots starting to dissipate. You'll see some of the brown spots dissipating, some of the redness dissipating. Really nice glow to the skin.
So this is before?
Before
this is
and after 6 weeks of using that. Yeah. So really nice.
Daily Power Defense.
Daily Power Defense with the GSR. So the in that kit. So you had the cleanser, the scrub, the pads, and the Daily Power Defense, and you can see there's some already. I mean, we can get further improvements for sure. This is just the basics, the fundamentals, right?
Absolutely.
No even sunscreen was included in this protocol. So normally we would have asked somebody to do a sunscreen, but this kit had those 4 items, and they did a before and after picture. It's not a picture from Dr. Obagi. It came from another clinic, so not to be shown online, but I'm just just so you know.
Too late for that.
Yeah, we'll keep it between us. But
and the internet.
Yes, exactly. So we just I'd like to show that one because you kind of see in 6 weeks what just the fundamentals will do.
Absolutely.
Now, if he had more severe pigment, which there's some pigment, I'd throw on retinol, skin brightener, and exfoliation, except some of the other products too. But already just doing the basics, there's some nice changes happening.
So if someone wants just like one moisturizer and they don't want anything else, that's the one
that's the one you go for.
Okay.
99% of the time, I'm selling somebody this, but at $166, that's not in everybody's budget.
Absolutely, yeah.
I'll bring out the renewal cream that's $50 less. That's kind of a nice, silver medal.
But it looks like this is the most effective. How long will this last?
This is a travel size. It normally comes in that big size there. This is the one that comes in our kits. Around, I say anything that's 50 mils, around 3 months supply on average, give or take. Now that's whether you're using it once a day or twice a day. That would certainly extend. Most people use this as their morning, but for me, when I go traveling, this is my AM, my PM, my I. I just gotta bring them basics because this guy kind of works as a one-stop shop for everything.
Yeah.
We love it. Love that product. Now, vitamins.
Well, if it's doing all of that and it's lasting 5 months, 3 months, that's awesome.
That's great. Michelle, check mark the vitamin C in that little booklet. I'm so sorry.
No worries, Rose.
Yeah, thank you. I just want to see here, GSR. Yep, okay, you guys have it. So,
wait, did I get the one with the check marks? Maybe I have the one with the check marks.
No, you have it. Oh, you have check marks too.
I have check
Look,
marks
I
too.
probably do this and put it back into my thing.
Oh, no,
sorry,
no,
ignore
no.
those check
Okay,
marks.
for sure.
I know I was doing this one because I remember scratching these
Okay,
off.
for sure.
So vitamin C, L-ascorbic acid. Are you guys familiar with vitamin C, ascorbic acid, and what that does? Is this new to you guys as well?
It's
A little
yes,
bit, okay.
yeah.
So vitamin C, there's I see C Bright, yes. That was the old name. It's now called. We had a whole rebrand last year, and it's very challenging for our accounts because you're so familiar with the old names versus the new names, etc. But our vitamin C is called 10% vitamin C self-activating. Worst name change ever as far as I'm concerned, but what it does is amazing. So our vitamin C, I want you guys to feel it two different ways. Put your hands out and you're gonna feel it first just on its own, by itself, which has got a really cool kind of a texture, almost like a, sometimes when I travel, little air pockets of bubbles,
Almost like a primer texture.
Yeah.
Kind of,
Yes.
Yeah.
Now, do you feel a kind of powdery
Yeah.
to it?
Yeah.
That's because it's like a pure ascorbic acid, doesn't activate till it touches your own skin. This vitamin C is actually supposed to go on last versus first. If you carry, which I know you carry the Vivier here as well, theirs comes in an oily droplet, okay? Like most vitamin C's come like that. It's weird, they shouldn't, because ascorbic acid is very unstable, and every time you're opening that, it's exposed to air. You're gonna see in those bottles it'll turn an amberish color. It goes brown or even with golden and yellow. That's because ascorbic acid's not stable. Air over time oxidizes it, lose some of the efficacy. So what was 10% is now 8, and then 6, and then 4. So with ours, what's really cool, airtight pump, no water in this formula. You're getting the purest form of ascorbic acid. Now, you felt how it has that slinky texture? Because there's no water in here, it's a high molecular weight, which means it's slow to penetrate the skin. So if you put this on first, it's gonna hold up your fabulous daily power defense from getting in. Dr. Obagi was suspicious of this, so he had 50 top physicians around the world layer it last as an over top of your moisturizer versus under, because we were doing it under for years. Vitamin C was always supposed to go first. That's only if it comes in an oil droplet, not like this. On the other hand, let's try the moisturizer and let's do the vitamin C over top, and you're gonna see how it completely changes. So give me this didn't have vitamin C on it? Okay, so give me the, oh sorry, I gave you a boatload there, that's way too much. Without the vitamin C. Okay.
Now, is this for the face or for everywhere?
Yeah, for the face, but you can also use it on the décolleté as well if you want to. A lot of women have the sun damage from t-shirts and things like that, the V-necks and whatnot. Now we're gonna put the moisturizer over top. Oops, oh, sorry. I keep giving you a boatload. And you're gonna doesn't feel as powdery.
Yeah,
Do you
absolutely. Feels
see
very
what it,
different.
right? So I wanted you to feel that, because if somebody doesn't connect with that powdery texture, oh, I don't know if I like that. Wait.
Yeah.
Let me show you how it's supposed to actually be. The moisturizer first and the vitamin C over top.
Yeah.
All 50 physicians that layered it last versus first came back with better results. So yay, so we're now changing it, and you do in the Zio world, it would very much differ from the Vivier world. Their vitamin C would go first because it's a serum. Ours, very different texture and formulation, still the same ingredient, the ascorbic acid, but ours goes last versus first. Now, this also has a second source of vitamin C, which you'll never repeat because it's called tetrahexadecyl ascorbate. But what it does is it goes further into the skin and prevents new pigment from forming by up to 80%. So vitamin C is known as a brightener. Most people bring a vitamin C into their regime to even out skin tone. So sun damage and frecklings, even a little bit of minor melasma, things like that. But it's also a potent antioxidant, so it's really going to be great to defend against environmental stress. I say everybody over the age of 30 should be on vitamin C, as acne prone excluded. High vitamin C's and acne prone skin don't like each other. So do not use if you're acne prone. Just want to put that out there, okay?
Is it combined with sunscreens? Because it prevents further pigment formation.
We always like to, anytime you're using a vitamin C, you should always use a sunscreen anyway. We always going to recommend that. There could be a little bit more sun sensitivity using a vitamin C with in the sun. It's also going to cause a little bit of mild exfoliation, which is, you might feel a little bit dry in the beginning. It's not, again, you're not drying out, it's just getting rid of the dead skin cells on the surface so we can reveal clearer, more uniform skin underneath, more even skin tone, and then this prevents new pigment from forming by up to 80% too. Really good to suppress the pigment that hasn't surfaced yet and keep it from surfacing, which is super cool. It kind of has a bit of a stingle. You might even turn pink or flush. Good, pink is in. But it's a great, mostly known as a brightener, but it also is wonderful for stimulating collagen. And like you heard, sometimes Dr. Obagi is kind of hard of hearing with his accent, his Syrian accent. I can never hear this part, it always sounds fuzzy. But he says after the age of 30, your cells start to go to sleep. So that's why I always say after the age of 30, everybody should be on a vitamin C if they can and aren't acne prone. Just because your cells get sleepy, and of course we're going to introduce them to retinol, but adding that little bit of vitamin C is going to help wake up new cells and help stimulate additional collagen and things like that. Usually in our 20s, in fact, listen, when I was in my 20s, it was a long time ago, you know, we were using dark tanning oils, we weren't tanning beds, you know, we weren't, it's a very different day and age. I know a lot of, you know, the millennials are all on SPFs and blue light protection, and, you know, so it's very different how it was today as it is, you know, 20 years ago. So I did a lot of damage to my skin sun-wise in my 20s and in my, you know, later teens. I baked for 45 minutes every day, 7 days a week at Fabutan. No, thank you. You never see that, right? You'll be like, whoa, would never do that now.
Yeah, no, never.
Right? So vitamin C, really good. Just this goes last versus first because of it's a unique, very unique formulation. It's never going to oxidize or turn brown on you. It's always going to remain stable, which is really great. So then you're going to see something called growth factor serum. We love the growth factor serum. It has a very unique texture to it. It too has it's a high molecular weight, same as this guy, means it's going to go last over top of your moisturizer versus first. Now you don't have to layer this with anything at all. You can just put this directly on the skin. So I'll let you feel how this one feels. It's got a really unique texture. Absolutely, you can sell this as an eye cream. It can go all around, like over top of your eye like that. So growth factors, we have two. They're plant and enzymatic derived. There are no human growth factors in here. Some people really like to hear that, some people don't care. What do growth factors do? Well, growth factors help to stimulate collagen. They actually thicken your epidermal matrix of the skin because they replicate cells. If we replicate cells, we're fattening up that skin, which is really important because as we get older, that skin becomes thinner, almost like tissue paper. You're going to especially see this on the neck and around the eyes. The skin becomes really thin. You'll start to see what I call cross-hatching, lines going one way and lines going the other way. Start to bag under here because the skin's thin. So if this actually in our clinical study was proven to increase epidermal thickness by 30% after 1 month. Twice a day application. Anytime we do a clinical study, it's AM, PM. So actually, I have...
That's really astounding.
What's that?
That's really astounding in terms of results.
Amazing. It actually increased elasticity by 50% after just 2 weeks. AM, PM, again, application. It's just been published in the Journal of Dermatology, that clinical study, and they had to do the study twice. The results were so good, they didn't believe it. They're like, that can't be right.
Like, can it go up to, like, on the eyelids?
You can literally
eyelids.
go like that.
Yeah.
I'll show you. Upper eyelids and lower eyelids. So if you're doing, do you inject Botox and filler here?
We do.
Yep, okay. So for your nurse injectors or the physicians who are doing that, I got so many clinicals in here, and they're all seen better days in my.
You've got a cluttered file.
What's that?
Cluttered.
Oh, clutter. Yes, story of my life. Here it is. Okay, so what I want to show you. All right. Yeah, a lot of people like the scent.
Really
It's been
nice,
through a few scent changes, but if you look at this is the white line
is that epidermis. Then you see dermis and hypodermis, so that's your skin layers. Epidermis is the outer layer, and then it goes deeper into the skin this way. You can see that whiter line's gotten thicker, but also the dermis and the hypodermis. That tissue keeps getting thicker and thicker and thicker the more you keep using it, which is amazing. So increased epidermal thickness by 30% here, but continued to increase thickness the longer we used it as well. Can you see that from that, Anne? Sorry, I don't know. Show you that.
So 12 weeks they used.
12 weeks. Well, this is only, that was at week 4, but the whole clinical study this was the full 12 weeks, but at week 4, already 30% increase in epidermal thickness. Never mind the full results coming in. And then I want to show you before and after pictures of the actual patient. So if you look at this, and this Pore study has been through so many trainings, but if you look at the full 12 weeks here, you're going to see loss of volume, some crepiness, but pay close attention to the upper eyelid from here to there. Do you see the less crepiness? Can you see that over there? I'm sorry, I'm trying to show this to the camera. You can just see overall the skin looks rejuvenated, doesn't look as crepey, doesn't look as sunken. I love this one. This is after only 1 month instead of 3 months.
Wow,
if you look at the softening of the crow's feet from this side compared to that side, there's the cross hatching I'm talking about, that kind of chicken skin that's loose.
Yep.
You know, lines going both ways, and you see some nice firming, and it's really hard to see because it's very shadowed and dark, but if you look at that upper eyelid from here to there, there's also less texture on that upper eyelid just 4 weeks later. And then I have a 2 weeks picture that I'll show you as well. And some
this is
people
twice a day?
AM, PM. So not everybody's going to do that, to be honest, okay? Because it's an expensive product. It's $175 for 30 ml.
Okay.
But whenever we do a study, we want to see what maximum performance, what we can get, so we use it a little bit more. Now, since the study, there's a lot of people who are doing it AM and PM.
Well, I mean, it's cheaper than buying radiofrequency services or Botox,
Exactly.
right?
Here's a really good analogy I like to share with patients, because they come for the Botox, they come for the filler, they spend the money on the lasers, but they hardly spend the money on the skincare. Think of your laser and your Botox and your filler like your dental appointment. You don't go home and not brush your teeth, right? You still gotta do your daily maintenance, you still gotta brush your teeth every day. That's just your checkup to take it to the next level. So your treatments like lasers and Botox and fillers, that's your dental appointment to really game change things, but we have to maintain that too. And the more, Dr. Obagi won't even do any procedures on any patients until 6 to 8 weeks, at least 8 weeks of skin first, to see what kind of transformation you can get, and then he'll assess, okay, now what do you really need? Because you're just, you see so many good changes with the skin. So sorry, this one was 2 weeks. Some people can't see it. I think it's the most obvious.
I think it's very obvious.
Right here,
absolutely.
can you see I call them crevices, because they really do look like crevices at this point. You see after just 2 weeks from here to there, there's some significant shallowing of those
even
deeper
the
lines. Exactly. The length of them has kind of shortened as well.
Looks like the Catalina Mountains from the plane.
Yes, that's right. Getting into the coulees from the mountain. So anyway, some really nice changes. There's an ingredient that mimics Botox in here. So it's called a Wagler-in-1 peptide, and this peptide targets the tiny little muscles in the upper layers of the skin. So with continued use over time, softens and relaxes expression lines, which is super cool. Now, we're not going to get the deeper muscles you'd get with a Botox needle, just the tiny little ones in the upper layers of the skin. But 3 to 5 months later, you're going to see a really nice softening of the skin. I have a before and after picture of the skin of the anti-aging kit. The anti-aging kit has the GSR, cleanse exfoliate pads, and then daily defense in the morning and growth factor serum at nighttime. And it was used over a 3-month period. And you can just see some nice changes, and I'll pass this around.
Nice.
But you can just, even to the marionette, you can just see some nice changes to the skin, the red, some of the brown. Up close, you'll see the nasal and marionette lines start to soften.
So just to reiterate again, that was the growth factor serum?
Growth factor serum. Still on growth factor serum. I know, because it takes a while to go through, but it's a special. There's a reason it's $175. Okay, so it's gentle enough to use twice a day, every day, absolutely on the neck. The skin there is the same density as the eye. Didn't know that. The skin on your eye and the skin on your neck, very thin. Eyes, hands, lips, and neck. show age the quickest because the skin's the thinnest. So if this is meant to fatten up that skin and replicate cells for those areas, it's awesome. I've never tried it over the lip. I don't imagine it probably tastes good, to be honest, but I don't know. But growth factor serum, amazing. It also has
Or you can put it on the lip
yeah,
itself.
sure you could. I think you could, absolutely.
Can you use it with the vitamin C?
Yes.
You can.
Yeah, I would put growth factor serum first, vitamin C second.
Okay.
Or you could do vitamin C in the morning and growth factor at night, but all around the eye area, twice a day, no problem. Safe for nursing and pregnant. There's no retinol on here. Now this is off-label, post-microneedling. Growth factors were triggered to heal before they ever came out as an anti-aging device. So they're wonderful for that. Now we don't have I can't literally say, Zio says it's okay for you to put it on right now. But off-label, do I have everyone in my clinics probably doing it right now? Yeah, I've been told. Sarah, absolutely, we do it all the time. I just can't give you the A-OK from Zio because we've not done a study on that to support it. But just off-label, if you're comfortable, that's up to you. Hydrating cream, we've gotten the A-OK to do that immediately after because we've tried it.
Yes.
And it comes in our post-procedure kit. So anyway, I know I beat that poor product to death. I'm sorry, but there's a lot of information for it. What you want to tell customers is going to thicken thin skin, help stimulate collagen, increase elasticity. It was actually clinically proven in the study patients felt 6.44 years younger after the full 3 months using the product. It's a big number to claim, and unless your patient's compliant, I don't know if I share that with everybody just because they're going to expect that every time, whether they did AM and PM application or not. So, but it's a lovely, lovely product. What I want to mention, half a pump is sufficient for face and eyes. If you're wanting to address the neck and the décolleté, you probably do want to dispense a full pump. But some people will use the full pump just on the face. You don't need that much, okay? More doesn't mean you're getting a better result, okay? A thin layer, push it in, massage it in well, and I would say that's for every product. Don't just slap it on and go. Really push it into the pores. You're going to spend $175 on this and $166 on that. You want them to stimulate and really get in there, so help.
It doesn't have to be just the face.
Nope. It can be anywhere, to be honest. Yeah. Anywhere. Okay, wrinkle and texture repair. Brand new. Newly formulated. This just happened within the last month. Wrinkle and texture repair. Now we're getting into boot camp, okay? So the daily power defense, the vitamin C, the growth factor, not going to cause any anticipated reactions. No redness, peeling, or irritation. The vitamin C may be very minor, but your wrinkle and texture repair, here we're going to get ugly before we're going to get good, okay? So this has got a 0.5 retinol. This retinol is very different than other retinols, including our other retinols. The reason why, it comes at you fast and hard. Most retinols have a slow delivery system. So if you imagine snow, how it falls to the ground, you can watch the snowflake land on your grass and then it accumulates on your lawn. So Radical Night Repair, Retinol Skin Brightener, those are epidermal. So they're better for sun damage and fine lines. Wrinkle plus texture repair. I want you guys to touch and feel it. Reminds me of a citronella. Oops, sorry. Brochure got a little bit of it too.
It'll be smoother.
Yeah. Wrinkle and texture repair. This one comes at you fast and hard. Think fire hose, not slow like snow. So it's going to punch through that epidermis. It's going to drop the payload of retinol deep into the dermis, which means it's better for deeper lines, textural issues like pores, laxity, ice pick scarring from acne, the debits you get from that, really good for. So the deeper lines that are there at rest, I'm going to show you, we just did a new...
So that goes well with Botox.
Yeah, wonderful.
And how about blackheads?
Well, retinol I love for acne too. I find you can better extract when you're using a retinol because it pushes everything to the surface. So if you have those stubborn blackheads that are hard to get at, I find using the retinol is really good to kind of give it 2 days and then try extracting it. Oh, those come out a lot easier than before. It's like I noticed that. So really good for acne retinol. This is in our Hydroquinone kit. This is in it's great for asthma. It's great for aging. It's great for acne. Retinol kind of is a triple threat. It does shrink sebaceous gland activity. This one also, because it's going dermal, is wonderful for pores. Really nice before and after pictures for pores. I'm going to show you a really great slider. If you guys want to follow anybody on Instagram, are you guys all on Instagram? No, yes,
not
really.
really, sort
Okay,
of.
never mind then.
Samantha is an Instagram model, right?
No, what? No, I'm not. I'm definitely
girl. She kind of has my role, but in the States, it's her name's Alicia Brown. She's amazing. She has the best before and after pictures, that she reposts from a lot of her clinics and things like that. But we have a new clinical study on wrinkle and texture repair, and I want to just show you the before and after slider. You're going to see some really nice changes to the textural issue, especially you see it on the cheek.
Oh wow,
Can you see that? So that's after 3 months of using wrinkle and texture repair, the newly reformulated version. We just got some of the Z-Core from our firming complex, that $330. Yeah, you can see that. Yeah. You tell me when it slides so that I can pass it on.
Yeah.
And then slide. Texture changes.
Do you show that to people on the plane too?
Well, I don't have access.
It's a conversation
to it
starter.
I know, totally. You know how you don't have access to your internet while you're out there, but yeah, it's a good. And then some pigmentation changes happen too.
Yeah.
That was just wrinkle and texture repair. So retinol is a tyrosinase inhibitor to digest a bit of pigmentation as well. But okay, now I'm gonna plug this in since it's down to 1%. I hate to do it because it's got so much. Right.
I can
Plug it over here. I see a little plug in. And I'll grab it as need be. Okay, so wrinkle and texture repair 0.5 retinol, start slow. There's also excellent before and after pictures on the upper eyelids. It looks like she had an upper bluff after 3 months. Honestly, the laxity, and I know I shouldn't do this because I'm damaging my own eye skin, which is already compromised. but
you have the products to fix it though.
Yeah, exactly. So yeah, this wrinkle and texture repair, although most people won't use it around the eye area because it's a 0.5 retinol, that's going to cause anticipated reaction, red, peely, flaky, tender, sore, but all for
Is that what you did to
and almost flush right away and turn tingly when I put it on because it's coming at you fast and hard.
Okay.
But I'll give this a minute. I'll let my phone just get some juice back in it, and then I'll show you some other before and afters. Also for the glabella and the frontalis, the lines up there, really nice changes with that wrinkle and texture repair because those, go deep into the skin. So if you're looking at somebody, you don't need to look like a Shar-Pei to use wrinkle and texture repair, okay? I know people in their 20s and their 30s who are using the retinol. It's $80 for the mini size, or it's $190 for the 50 ml size. Doesn't make sense if you do the math. You can buy 2 mini ones for $30 less than the big one and have 10 mls more. So I always recommend patients to buy the 30 ml version because $80 is so much easier to sell to a patient than $190. And because you start slow, so normally I'll say twice a week, Tuesdays and Thursdays for the first 2 weeks. Then after that, you're going to bump up to 3 times a week for 2 weeks. So every 2 weeks, put for every 2 to 3 weeks, because that will depend on the patient. Oilier, thicker skin can go through it better than a drier, weaker, thin skin can. So every 2 to 3 weeks, add another night. The goal is to get up to nightly. Will be the goal. Doesn't mean you have to, but that would be the goal. You can use it around every single product from ZO has been tested around the eye area, and like I'm going to show you later, please don't let me forget, because I'll probably forget once we get into other products. Just show you the before and after on the upper eyelid. It's pretty crazy actually. And then again, also in the deep glabellas in this. Anything with deeper and pores, if you look at an orange from a distance, smooth, you look up close, all those little pores in there, that's a texture issue. You gotta go dermal. So that's the one that goes with that, okay? So this is 0.5. To replenish your skin. So we like that. If you turn the page, you're going to see Radical Night Repair. Put hashtag game changer on this one because this one really is a game changer. If somebody was to ask me, Sarah, if there was one product from ZO you can guarantee me results, like without a doubt going to see some changes to my skin, Radical Night Repair. It's now a 1% retinol though. It's twice as much retinol as wrinkle and texture repair, and because instead of coming at you fast and hard, we're coming at you slow like snow. So we're gonna hit the epidermis. That top layer is gonna, like snow falls on the ground and accumulates on the lawn. That's what happens here.
You're gonna hit up that epidermal top layer. You're gonna flake like crazy. You're gonna see more anticipated reaction with this because it's all epidermal on that top superficial layer. You're gonna flake, 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 flake. All those dead skin cells are gonna come off and you're gonna be gorgeous and glowing. So it's wonderful for fine lines and sun damage. Whereas wrinkle and texture repair, deeper lines and textural issues. So Radical Night Repair, I got some unreal before and after pictures for. I'll just again let that settle for a little bit, get some juice in it. But you want to go really slow with this one. PM only. Now I say avoid the neck and the eyes. They've both been tested there. They're fine to use there. I got some beautiful before and after pictures on the neck after a year of using this. Holy laxity improvement, insane. Love this for pigment and your little acne discoloration marks left behind. The best zit zapper on the planet. The most expensive at $210. It's not going to be for everybody. But there's, again, no water in this product. If you look at every other retinol, water is almost the first ingredient.
What is this called again?
Radical Night Repair.
Radical Night Repair.
And where is it? Perfect. But if you feel it, you'll see. Did they put this all in here for a training today? Is that why they did that?
Mm-hmm. Yeah, but so went through them quickly.
Yes. This one. Zamboni. Okay. So if you think of a Zamboni, have you guys all seen a Zamboni? You know what it is? Okay. So if you watch any kind of hockey game, you know, they break, they go off the ice, the Zamboni comes out, dumps that hot water, and you see that gorgeous glassy look. Zamboni. Okay, so your top layers all come off and you get left with the most amazing glow. Even if you don't put it around your eye, it's going around your eye. It's gonna seep there anyway, trust me. So I always like to recommend patients to put their eye cream on first if they're using an eye cream, and then the Radical Night Repair. Just kind of, don't put it over top of the eye area. Yes, you can, but it's gonna go there anyway. And if you have that little barrier of cream underneath there, it's gonna be better, less anticipated reaction. So to reduce anticipated reaction, you can layer your moisturizer like the Daily Power Defense first, and then you put your, so you put this one on first, put this guy on second. Now there's a barrier between your skin and that high potency retinol.
So how long before you start to see radical results from the Radical Night Repair?
3 days later.
Just 3 days.
Like honestly, your skin starts to shed. Actually, this was mine.
So it's almost like a skincare product version of dermaplaning?
Yes.
Right? Can you combine them, or is that too much? You shouldn't combine them, right?
Well, I've never done. I bet you can. I know some people who will do the dermaplaning first and a peel after. If you dermaplane and then put retinol on, you're just going to get much more of an anticipated reaction. Let me check with my trainer before I give you the A-OK on that, just because I don't want to tell you, yes, you can do this, and she's like, no.
I imagine growth factor or,
those are fine.
Or something else
growth
would
factor,
be even
else,
better.
Yeah, totally. But you're not going to get any flaking or sloughing, and some people want to see a flake or slough, okay? So radical.
So maybe space it 2 weeks apart from the dermaplaning.
Yeah.
So you get mechanical and then you get chemical.
Yeah, for sure.
So could it be similar to a chemical peel, but like this is more tame, that you can use it?
Well, it can be more aggressive.
Oh, it can be. Oh, okay.
Yeah.
Oh, okay.
Again, I'll show you some more.
Sure.
Yes, so what happens is, so let's say we used it all tonight.
Receipts.
The receipt paper? Like is that for the Star Machine? Oh no. You're gonna have to print them off the computer. Or the print.
We'll email them.
Yeah. Or
Except our record ones. So that's what I'm missing.
Oh, our record, we'll just have to probably print them on paper and we'll just write
I'll
them.
make I'll start a list.
So you said after 2 to 3 days.
Oh yeah, Dr. Obagi.
Wow.
He's a little bit more aggressive than what most people would do, so use your discretion with that. But he'll get people back on a protocol like a week after an ablative laser treatment. Yep, let's get moving. Let's get those cells turning over again. So if not everybody wants to do that, I think after a dermaplaning, I'll find out if we can, again, it's off-label.
Did you say Angelina Jolie is his patient?
What? He kept, Sophia.
Oh, is that confidential? Sorry.
That's okay.
We're just sharing it with the internet.
Yeah.
Oh. Should not have divulged the information to us.
I think has been there. I know. My boss was there, meeting with him to bring on Zio while he was treating Angelina Jolie for 6 hours. But Sofia Vergara, loads of the housewives. I've heard Sandra Bullock, Janet Jackson,
Jennifer Ann's I've heard several. I don't know who's all using
That's
it.
what happens when you happen to be located in Beverly Hills versus here.
That's it. You get those people walking through your doors, right?
Yeah.
So Radical Night Repair, you guys, start twice a week for a month. So very different. That's not every 2 weeks you add another day. It's every month you add another day. Okay, so you're gonna do twice a week for the month of March. Come maybe Tuesdays and Thursdays, 1 to 2 pumps. Come April, you're gonna bump up to 3 nights a week. So maybe Mondays, Wednesdays, and Saturdays. Come May, 4 nights a week. Come June, 5 nights a week. Come July, 6, blah, 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 until you're up to using it nightly. Not everybody can go through that because you're gonna be peeling and flaking with this for at least 6 to 10 weeks, depending on the customer. So not every, I can't stand the flaking and the peeling, it drove me crazy.
Yeah.
Anytime you stop using it, you have to go through it all over again. So try and push through it the best you can. I have one of my accounts in Edmonton, they're my top Zeo account. Just came back from training with Dr. Obagi in November in California. And one of the nurse injectors there does Radical Night Repair on her patients every night for 8 weeks, which is so crazy, so aggressive. And she says, you're gonna hate me, you're gonna be red, raw, peeling, sore. But I promise you at that 8-week mark, I'm gonna be your new best friend. And we've never had one returned. Like they all do it, they go through the ugly. It's really hard to get your patient to do that and commit to that. I certainly recommend selling them the hydrating cream that calms their skin. That's the perfect complement to this product, is selling them a mini version of the hydrating cream because there's no retinol in there. And when your skin is reaching out for you for a life vest, a life jacket, because it is sinking and it is hurting and it's pink and it's red and it's sore, that hydrating cream is its best friend. You're like, oh, that just feels so good. So like how you felt today, it felt really nice and comfortable.
Can you show it to us? Do you have it there?
Hydrating cream.
Yeah.
This one here.
Okay.
Yes. It has a 1% colloidal oatmeal, so it rapidly reduces redness and inflammation. It's got 2 peptides to stimulate collagen. That the skin
So
will be
can you explain to
immunizing.
me, from a guy who doesn't use any skincare,
Yeah.
how is this better than anything bought over the pharmacy that's cheap, generic stuff?
Well, I'd have to get a comparison list on a calming product, to be honest. But this, what I would say,
Your anecdotal knowledge, what do you?
yes.
Yeah.
So I would say from like different pharmaceutical and medical grade, completely different. So here's the thing. So in your Shoppers Drug Mart, your Sephora's, your department stores, the retinol percentage they're allowed to carry is a 0.02. That's the highest. Okay, we go 0.5 and 1%. Same with the glycolic acid, the salicylic acid contact. They're only allowed to have a certain percentage, and medical grade will have.
So it's
far
more concentrated, has more punch.
More concentrated, has more punch, will get you there faster, and also the ingredient. So they'll I'll even see oil of Olay, Jennifer Garner on a commercial, retinol 1%. No, retinol palmitate. 1%. That's a derivative of retinol that's not going to cause any anticipated reaction. There's a brand out there called Drunk Elephant. Have you guys heard of it? It's big at the Sephora brand. They carry a 1% retinol, and I asked some of my accounts, or the girls I'm training with, or even some of the clinics, because they've heard of this Drunk Elephant. A lot of my patients are coming in, Sarah, with this Drunk Elephant, and I ask your patient if it causes you to peel, if it's a 1% retinol. Oh no, there's no peeling or flaking. Okay.
And they think it's a good thing.
No, yeah, not retinol then. It's retinol palmitate, a derivative of, not a weaker version. Do you know what I mean? So we will use higher concentrations of the key ingredients like retinol, ascorbic acid, glycolic acid, things like that, and hydroquinone, which you often don't see in those department stores either. Because when you're using some of these higher medical grade products, there's going to be some affiliated downtime with them, and so you need to know how to troubleshoot that. If we sold Radical Night Repair 1% retinol in the drugstore, we'd have people returning it left, right, and center, thinking they've been burned or look at what had happened. No, we can't have that kind of thing there. So we need the guidance of a medical director to help troubleshoot some of that, tell you how to really use it appropriately. If you work at Sephora, yes, it's fabulous for makeup and of course skincare and hair and everything else, but could you expect one person
to know 85 lines in the clinic really well? No. It's hard to already know the ZO and the Vivier, and if you have 3 lines, it's hard to kind of feel really confident about it, never mind just one. So you throw 85 lines in there, and they're not going to be able to tell you everything about every ingredient.
And you said that pharmacies can only carry products up to 0.02% retinol?
0.2 at the most, so 0.2.
Okay.
So in between, like just ours is, our lowest is 0.25, and then 0.5, and then 1%.
Okay.
So they're closest, their highest one would be closest to our lowest one.
To the lowest
Does that
one.
make sense?
Yeah.
Does that answer you a
Yeah,
little bit?
so people who come in from just the harsh winters here with dry skin on the arms, legs,
Yes.
whatever, this is good for that.
And yeah, the hydrating cream,
Yeah.
excellent. Eczema, atopic dermatitis, psoriasis, even on kids and babies. I've been using this on my daughter's mom since she was 6 months old.
Now, you said psoriasis. Anything else that works for psoriasis?
We like this guy the best. Just it has an ingredient called Ophiopogon japonicus root extract. Who cares? But what it's going to do is it prevents bacterial intrusion, which is really important. Then you have the calming agents like the 1% colloidal oatmeal, rapidly reducing the redness, the inflammation. It also helps de-itch the skin. There's a de-itching component and prevents scab formation. So
good for eczema too.
yes, it's excellent. We just did huge clinical studies, brand new clinical studies for this product for eczema. And it's because we added this Ophiopogon japonicus root extract that prevents bacterial intrusion. That's the newest ingredient for it. It's awesome for eczema. Yes. Do you suffer from that?
My husband and my son do.
A lot of kids suffer from eczema.
My husband's is really bad. Like he scratches it totally.
Yes, he'll love this. Love it. And we do clinical studies, which is very different than what your Sephora and your department brands will do. So we know that it's going to give you a result because we've done the homework on it.
Yes.
Radical Night Repair goes slow. It's fabulous. It's my game changer product, but not everybody wants to go through that anticipated reaction. You're going to look a little worse before you look better, okay? But you kind of have to do that. So it's epidermal, better for fine lines and sun damage. Best it's ever on the planet. If you have an ingrown blemish that hurts to touch and you know in like 3 days it's going to be a natural disaster, you put a little bit of this on there and it just shrinks it and goes away.
Which one is that?
Radical Night Repair.
Ah,
This guy.
oh
Yeah.
yes,
I know
same.
it talks about it more for anti-aging, but best it's ever.
That's how good it is. We've been on it for like 30 minutes now.
Oh, I know.
That's good.
Exactly. Sorry.
No, good.
We're going to cover 5 SKUs in this.
No, but you said if there's one thing you'd recommend,
One
is
thing.
that one, right?
Yeah. Now, it's not going to be for everybody because of the anticipated reaction it's going to cause, but game changer. Holy, you want that gorgeous glow? Boom, that's going to give it to you. Also good for lentigos and things like that on the chest. Careful on the chest because it's really aggressive. But you'll see some patients' shins that are certainly more mature with all those brown spots on the top, and you almost connect the dots almost. Excellent.
How about regular
Sun damage.
birthmarks? Or
Yeah. Like I don't want to show you because I have it right here, but like a little lentigo.
We're going to be banned from Facebook because this is going to be too graphic, right?
But you'll see that almost like a raised brown spot. Lentigo, really good for that type of a thing because it's all epidermal, superficial exfoliation. Wicked. Do you want to get rid of your freckles? No, I was going to get rid of them.
Sun damage? Like
Yep.
sun damage?
Wonderful.
Huh.
Wonderful for sun damage.
That sounds like a miracle drug in a box.
It's honestly ridiculous. But it's again $210, so it's not for everybody.
You know what? For all that stuff that it does,
Yeah.
it's honestly, you could spend 100
Way
times more on lasers.
Trying to get there. Yeah,
Exactly.
honestly. And let's see if I have see how charged my phone is because I really want to show you some great before and after with that. 25%. Good enough. Okay, I'll show you. And you'll see how to do it as a peel. It'll tell you how to do it as a peel down below. It'll give you a mild, a moderate, and a severe, saying 5 pumps morning and night for 5 days, 8 pumps morning and night for 5 days, or 10 pumps morning and night for 5 days. It's not comfortable, and it's certainly not something you would start at, but I'll show you before and after pictures. Take a look at that. I mean, just sun damage. Nothing else was done. That is just radical
Oh, so
night
on the
repair.
left, I don't know, but on the left I see all these freckles.
Yeah,
and,
they're gone.
Wow.
It shaved it all off. So bye-bye sun damage, because that would have been exfoliated like crazy. She would have flaked like crazy. So bye-bye top layers of pigmentation. Oh, sorry.
Kind of like what
Hello,
Michelle is
skin.
doing right now.
right? Like nothing else was done, just gorgeous glow. Amazing.
And that's AM and PM?
Yes.
5 pounds, 8
Yeah.
pounds,
Don't
6
do that
pounds?
out of the
Yeah.
gate, ladies. I'm just gonna let you know.
Yeah.
You'll know why if you do. Yeah. And I had, so I'll show you another customer. So this is a customer from Saskatoon actually, and she did. Oops, I gotta Google her here. She did. She's like, Sarah, I'm doing the 5 pumps morning and night. I'm loving it because she doesn't like too much anticipated reaction, and this was going to certainly cause her anticipated reaction. But I'll just show you. Minus the name. Look at the shedding in her skin. So if your skin's going to shed like a snake, you're gonna lose all that pigment, right? So come off in sheets. Bye pigmentation. So it's pretty amazing. It's like there's your dermaplaning right there.
Yeah.
You know, times a lot more.
Well, it's also like a chemical peel.
That's why they call this the retinol stimulation peel.
Yeah.
So wonderful for sun damage, fine lines, and wrinkles. Amazing. There's another, again, if we follow that Alicia girl on Instagram, I'll show you using the Daily Power Defense in the morning and then the Radical Night Repair at night. Now, fair enough, this took a year to get the results because we went slower because it's more aggressive. But I want to show you on the neck and you'll see for pigmentation. Where is it? Here. Beautiful results before and after. Sun damage took 9 months and laxity on the neck took a year, but nothing else was used besides our aggressive anti-aging kit, which is the GSR Daily Defense in the morning and Radical Night Repair at nighttime.
After how much?
That was 9 months for pigment and 1 year for laxity on the neck, but that's because it's so aggressive you can't use it all the time. But I mean,
especially on the skin, on the
neck area, exactly. But lovely, nothing, no lasers were done here. That's just skincare, and that's why Dr. Obagi will do, like 6 to 8 weeks before doing any patients. He really wants to see what we can do because you can stuff your face full of Botox and filler and end up looking like a surprise bloated alligator, but you still have pimples, you still have sun damage, you still have freckles, the fine lines that the Botox is not going to get, right? So, okay, moving on. Sorry, ladies, I know that was a bit much. Let's get into, I think you have the Pore Refiners next. You do carry this one here. I love Pore Refiner. Again, we did our homework on this one, ladies. We did clinical studies. It was proven after just 1 week. 97% of the patients notice a visible reduction both in pore size and the amount of pores that they have. So the Pore Refiner, I love the way this one feels. It's super light. It retails $70. It is going to reduce pore size, pore depth, and the amount of pores that you have. But there's it gives like a filter effect. Sorry, brand new. It gives like a filter effect where, there, I knew it was coming. It's super lightweight, and there's an instant de-shining to the skin. So it mattifies the skin. If you're pooling oil or you have that shiny T-zone, this will keep you looking matte and fresher for a longer period of time. But it also gives a filter effect. It kind of fills in everything too. And when you put your foundation on, it just looks better when your makeup just looks better over top of this versus when you don't use it. So it almost has that makeup primer quality to it a little bit. Really, really lightweight. Shrinks pore size, pore depth, and the amount of pores that you have. Controls sebaceous gland activity. There's that Rosa Canina extract that's in our acne treatment pad that's in here. Shrinking oil production and tightening your pores. Then it has another ingredient. It's called the salicylic oil phytophagosine. Who cares? What it does is it exfoliates the dead skin cells around the pores. Pores are a sign of age. So pores are a nice round hole when we're young, but gravity yanks over time. The skin loses its elasticity. It starts to fall. We lose our fat pads, and the skin will sink. So what happens is that pore becomes an oval, kind of like an earring over time, or an ear hole over time with a heavy earring. It's going to stretch that ear hole out.
I hope it doesn't do that.
So it becomes to elongate, okay? So what this guy does, and around that hole in your face, that pore, dead skin cells collect around it. So now it almost looks like a donut ring. So that pore looks even wider and
deeper than it naturally should be. Kind of like a gopher hole, if you would, weird analogy here. There's a dirt around that hole, so it gives the illusion of a wider and a deeper hole. If I vacuum the dirt around that hole, you're left with a smaller opening. So that's what this salicylic phytophancine does. It exfoliates those dead skin cells around the pore, and then you're left with that smaller original hole. We can't take pores away, and that's impossible. But we're gonna, shrink the dead skin cells around there, or not shrink, get rid of the dead skin cells around that pore, giving the illusion of a deeper and a wider hole. And then we have this Hydroquinone extract helping to control sebaceous gland activity, reducing oil and tightening that pore up too. So it smooths out texture, because pores are a sign of texture. As we get older.
So we can't reduce the number of pores, but presumably
we can
they
give
could.
the illusion that they're invisible.
Plus the accumulation of all these products and dirt in the holes will make them bigger over time.
That's right, for sure, absolutely.
So you're preventing it from getting bigger.
Exfoliating is so key too. With just doing your the GSR stuff, there was a 31% reduction in pores just doing cleanse, exfoliate, tone with oil pads. Never mind when you put the pore refiner on. You know what I mean?
Could you use that then in place of like your makeup primer?
We don't talk. Yes. Somewhere to be, I have somewhere to be every day. If I have I want to look an event, and I want to look, and I go from work to an event afterwards. At the end of my day, my makeup's all slid off. I feel like, did I put makeup on? Where'd it go? Your makeup just lasts better. You look more matte. You don't look as shiny, and it fills in imperfections. It acts like a makeup primer. Like me, it's 100% Sarah. I completely agree with you. There's that little bit of quality. Zio wasn't promoting that, but I'm, as a girlfriend scenario, I'm letting you know, I really do feel like it does. Your makeup just looks better when you have it on versus when you don't. Then there's huge anti-inflammatories in here and anti-redness. That's important, because when your skin's inflamed, your pores look deeper, kind of like a strawberry. You know how if you look at the strawberry seeds. So we don't want inflammation. Inflammation bad. We don't like it at all. And it also contributes to pigmentation and a variety of other things. But if we can reduce the inflammation, the pores aren't going to look as pushed at. The skin's not going to stretch out, so that pore looks even deeper. 12-hour time-released antioxidants are ZOX12 complex, so A, C, and E, that are time-released over a 12-hour period as well. So we love it. $70. It's a snob. It needs to go first in line. Okay, so after you do cleanse, exfoliate, tone, pore refiner trumps your moisturizers, sunscreens, and it has to go first. If you're layering it over top of other things, you're wasting your money. You're not going to see the result. Okay, so it needs to go on first. Enzymatic peel, you guys don't carry. Exfoliation accelerator, you don't carry. Wish you did, you don't. So I'm just going to pass on.
Okay, so sorry. That one, would you put that on after you exfoliate it then?
Yeah, so cleanse, exfoliate, pad or tone, pore refiner. Or if you're just cleansing, cleanse and pore refiner. It's not like a makeup primer that would go over top of your makeup right prior to foundation. Do you know what I mean?
Yeah.
It needs to go on first, and your makeup still looks great. It's just, I love it. I love this product. To be honest, it's hit and miss. Those who don't have, listen, we all have pores, but those where the pores aren't super obvious, they're not wowed by the pore reduction. Well, that's because you can't make the skinny girl look skinny if she's already skinny, kind of a thing. Do you know what I mean? So, but those with really enlarged, dilated pores, game changer. They really do see a significant difference. There was a gal in one of my clinics in Calgary. She's stunning, gorgeous Asian goddess. She's in love with Zio products, and she was really excited about the pore refiner. And because I love it so much, I was excited for her to try it. And I followed up with her after using it, and I'm like, Sarah, tell me, what do you think? Isn't it great? And she's like, yeah, I don't know if I really felt wowed by the pore reduction. And we were in a training with about 5 or 6 other girls, and other girls all said it for me. Sarah, you don't have a pore on your face. She looked like a porcelain doll, you know. So hard to change something that's already perfect. But those who really see the enlarged pores, if I'm talking me to you and I can see your pores, you're a candidate, kind of a thing. Do you know? And I'm not saying you have that. I'm just saying as a patient comes in and we're this far apart and you can see the enlarged pores, they're gonna like this product. if you have to like really, you can't see because the pores are so small. They're gonna like the fact that it has antioxidants, mattifies their skin, makes their makeup look amazing, but they're probably not gonna notice a huge wow difference.
Is it normal to use a magnifying glass to look at some?
No,
to
but
try to
I
find-
would love that, but I don't carry one around myself.
Yeah.
To be honest, but you could. You don't need it if you have them. Use it for
Well, the idea is if you need that, then you shouldn't be using this.
Exactly.
Yeah.
Exactly.
Does it help with like stopping blackheads from happening? if
Yeah,
you're using it, like,
I
if it's
find
not
there,
right?
because it's the dead skin cells. Sorry, this again is a big name, salicylic phytophangacine. It exfoliates the dead skin cells around the pore, preventing congestion. So it's
Yeah.
great for. You literally can use this as an acne moisturizer. You could go
Okay.
GSR kit and this because it's controlling oil, mattifying the skin, exfoliating the dead skins around the pore. So you could and antioxidant benefits. You know, nice and light, not heavy. You guys felt that it's not weight. There's not a lot of weight to it.
Yeah.
Oh, 8 minutes left. We're not going to get it all done. Dang it. Okay. So because we have, you guys close at 5, is that it? And we have you till 5 o'clock, is that what's happening?
You can stay till 5:30.
Oh, can
Yeah.
I stay till 5:30? No, sorry guys, you're probably like, thanks Sarah.
No, we work till 5.
Yeah.
Oh, you're doing
Yeah,
okay.
yeah.
If I can have till 5:30,
It's up
that'd be
to you.
great.
Oh my
If
god.
that's okay, Michelle?
Yeah, I might have to.
You might have to duck out, no problem. Okay, so we're gonna get into pigmentation. You carry Bright Alive, Retinol, Skin Brightener, and the Hydroquinones. I think you have it all here. So, okay, beside your Bright Alive, put Walk. Beside your Retinol, Skin Brightener, put Jog. And we're gonna get into Hydroquinone after. This will make sense to you in a minute. So, Bright Alive, love this product. Some of the anti-aging things, I apologize it took so long, but there's some science I need to give you all the inside information. Bright Alive, this guy's safe for nursing, safe for pregnant, no downtime, no anticipated reactions, immediately good for post-microneedling. No retinol, no hydroquinone. Okay, so this has a skin brightening complex with 15 different skin brighteners to even out pigmentation, sun damage, and freckling. Melasma, and now it's not going to get you there the fastest because there's no retinol and no hydroquinone. It's a bit more of a walk to the finish line, but I have had this change. One of my plastic surgeons, she got pregnant. While she got pregnant, of course, that changes, your hormones change. Her melasma came out full force. And so the only thing she was allowed to use to correct from pigment while pregnant and nursing was Bright Alive. So she used this every day, twice a day, helped reduce her melasma by 70%, which was amazing because I didn't think it could do that, to be honest.
7-0.
7-0. And so she, again, maybe it didn't happen overnight, fair enough, but over time. And while she was pregnant, nursing her first, she got pregnant with her second, and her melasma didn't come out nowhere near as by half. She said it just suppressed it, really kept it. Do you guys do hydrofacial hair? I said you guys did.
We
No.
are bringing something that's a combination that does a little bit. Yeah.
So anyway, that hydrofacial rep, she's from Brazil, and she goes back home every year to visit her family. And she, we were given, because we have hydrofacial boosting serums with ZO for hydrofacial machines. Different companies, but we've partnered with them for some boosting serums. And she was given the Bright Alive just as a, hey, this is what the product is that you could follow up after your hydrofacial. You can now give the patient a brush your teeth, hydrofacial dental appointment, brush your teeth, and take this home with you. So you maintain results and get additional results. And she said, Sarah, for the first time ever, I brought your product with me to Brazil. I was there for a good, 28 days. My pigment always comes out. For the very first time ever, it did not get while I was there because I'm in this heat and the sun all the time, but for the first time her pigment didn't get worse, which was amazing. So it's really, really good at suppressing pigmentation. All of our brightening agents, whether it's Bright Alive, Retinol, Skin Brightener, or Hydroquinone, follow what we call the ABCs of brightening. I think it's too much information for you guys to write this down. If you want to, go for it. I'm just going to give you some background information. But A stands for arresting chronic inflammation. Inflammation is what causes pigment. Sun causes inflammation, that causes pigment. Sebum causes inflammation, that can cause pigment. Hormones cause inflammation that cause pigment. Okay, so this A, if you're going to arrest chronic inflammation, you're going to block some of that problem, okay? Then B is to break up existing pigment. There's ingredients in here that break up and shatter the existing pigment you have, and then there's additional ingredients, C, that control new pigment formation. So A is to arrest chronic inflammation, B is to break up existing pigment, C is to control new pigment formation. And we have about 4 different ingredients that are both in the Brightener and the Retinol Skin Brightener that really make it hard for new pigment to come back. So we're really good at suppressing it. All of our brightening agents, and this is what sets us apart from other companies, we don't just brighten to give you the quick fix. We want to prevent new pigment from forming. So we're going to try and prevent new pigment from forming at the same time as correcting it, which is super cool. I want you to touch and feel it because it smells amazing. It's from all my new testers. Really nice and lightweight. I personally love the Brightener with the vitamin C over top. So it'll take it, both products work beautifully alone, but if you wear the vitamin C over top of this, boom, you're going to take it to another level, okay? So Brightener would go first, vitamin C, our vitamin C would go over top, Vivier's would go underneath. But I love, love, love this product. It's the perfect product for summer when you don't want to be on high retinols in the sun or hydroquinones that are going to make your skin more sun sensitive. This I brought to France last summer. It was a 44-degree heat wave. I just brought my GSR, my Brightener, and my sunscreen for the entire time. Not one spot came out. It was awesome. Also good for neck and décolleté. Right?
Do you normally freckle when you're exposed to sun? Yeah.
Mm-hmm. Also good for the neck and décolleté because there's no irritation. And I'm just going to go there. Do you guys do laser hair removal?
Yeah.
Do you do the bikini area?
Mm-hmm.
Some people are darker down there over time or just naturally are darker down there, and if you wanted to brighten up the bits below the waist, both the front door and the back door, Brightener can do it safely. Just gonna go there, okay? Sorry, Facebook. Or whatever. But some people might actually appreciate that little tip because some women can't get laser hair removal down there because they're darker on the skin down there. And so they need to brighten that up, and you can either do the Brightener or the Retinol Skin Brightener 0.25. The lower one would be okay just to go slower in that department, just giving you a heads up.
And how long before you see significant results with this?
I have 2 months after, with Brightener.
Yeah.
So again, all of our clinical studies are
3 months? 3 months, okay.
But I mean, it doesn't mean you're not going to, I did Brightener twice a day, every day for 7 days, and notice nice lightening on my freckles, okay? So it doesn't mean you're not going to see it before that, but again, our clinicals are always 12 weeks, so I get that result. Retinol Skin Brightener is now going to be a step up. So now we add retinol to those ingredients, and we're going to get there faster because we're going to cause that superficial exfoliation. Like the Radical Night Repair, the retinol comes out too slow, like snow. So we accumulate on the lawn. You're going to flake like crazy. Bye-bye surface sun damage. Hello, gorgeous, glowing new skin underneath there. I'll show you 2 months of using the Retinol Skin Brightener.
So we offer the 3 different.
You offer all, so listen, you can walk, jog, or sprint to the finish line just with this one product. So if you see before and after, 2 months after using that Retinol Skin Brightener, you bye-bye freckles. Freckles are superficial. So really nice.
That's very significant change,
Yeah, really nice change.
It's almost hard to believe all these photos you're showing us.
It's because we're amazing. The Zeo glow does not lie. But you have to be compliant. If you're going to take this home and use it once a week, don't expect that kind of result, right? So really, really amazing results. And like I said, at least you follow that Alicia Brown girl, her pictures smoke what I'm showing you. Like 2 weeks results with hydroquinone, 4 weeks. Enzymatic peel on the heel for a week, amazing. So again, I know you're not all on Instagram, but if you join that world, give me a hoot and holler. Alicia, so ALICIA, and then brown like the color. _ Zeo Skin Health. She's got some really wicked before and after pictures. Cool. And it's all Zeo. It's all Zeo, nothing. I mean, if there's anything added, she'll mention. plus IPL or whatever it is, but I love her stuff. So Retinol Skin Brightener, you guys. I love this product because it's a 2-for-1. You're addressing aging and brightening in one bottle. So this is perfect for either the lazy customer or just the patient who honestly doesn't have the time. 3 kids, 2 jobs, homework, kids' activities. They get home, they're tired. By the time they get to bed and do their regime, it's 10 o'clock. They don't feel like doing 9 steps for brightening or whatever. So, you know, they're gonna ask you, listen, I'm getting older, I've got some sun damage, is there maybe one product that could kill two birds with one stone? Retinol Skin Brightener. Because retinol and vitamin C, those are the two ingredients that are in here. Well, there's several more. This kind of smells like the Wrinkle and Texture Repair. So it kind of has that same color, that same citronella candle, Aveda hair care, or perm, depends on who you talk to. There's like, okay, it goes bad, and then smell it in a minute, and it's better. So it kind of is not bad, and then it, goes kind of ranky, and then it gets better again. Give it a couple minutes.
Well, it goes more citrusy.
Yeah. Oh, do you? Okay. Well, that's good.
It's not.
I also love this for sun damage on the arms and the legs. That patient with all those lentigos down the shins, go for the 1%. Just get rid of it. But I usually like to start somebody on the 0.25, graduate to the 0.5, graduate to the 1%. The 1% is very, very aggressive. Don't start there. Honestly, you'll have a lot of hand holding and anticipate a reaction. But you can, doesn't mean you can't. But this, honestly, is such a great product. This whole chart back here is too much science, but what this is showing you is all about the retinol skin brightener and how it's blocking new pigment formation. So inflammatory messenger, sun, sebum, hormones, cause a whole cascade, damages your melanocyte, and then tyrosinase and pigmentation start to form. Well, we have all these different ingredients blocking that pigment formation, okay? So if we're gonna interrupt that messenger here, and if that didn't do it, we're gonna interfere over here. If that didn't do it, we're gonna interfere here, ding, 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 all the way down. So it's really, really, really good at preventing new pigment from forming while addressing existing pigment, either that you already have at the surface. It's gonna exfoliate all those dead skin cells. You saw that freckling before and after. Gorgeous ZO glow. There is going to be some anticipated reaction with this one too, so start slow. If you're on the 0.25, I say start 3 times a week. If you're on the 0.5 or 1%, start twice. So, and again, every 2 weeks, again, you can acclimate and build up to using another night. So every 2 to 3 weeks, I would say, depending on the patient, build up slowly and get up to nightly use. It can be used in the morning. There's a protocol that uses the high retinol in the morning and another retinol at night. It's a bit aggressive in our dry climate. I don't often like to recommend it. Most of the time you're going to be using retinol skin brightener at nighttime. So you could do something like the Brightner in the morning with the vitamin C over top, and then you can take your retinol skin brightener and do that at nighttime when your skin's 8 times more active, like you were saying. Put on that a little bit more punch, yoga, then do boot camp, you know, but really, really nice regime. On that note, before you leave, Michelle, I want to, I've done a 2-pager. We have a whole protocol booklet that's like 20 pages. Sometimes it's a bit much, so I like to do a little 2-pager cheat sheet, and what it has the anti-aging products, the brightening products, the rosacea products, and the acne products, because those are the 4 conditions we see most of the time. And it's going to give you a mild, a moderate, and a severe approach. They're listed in order of how you would apply them. So AM and PM, GSR, cleanse, exfoliate, tone, choose the appropriate cleansers and toners. Then you're going to see, you know, if you're looking at your anti-aging products mild, cleanse, exfoliate, tone, pore refiner, if that's what you're doing, that's where that would go. Then the daily power defense, then the firming serum. Now listen, firming serum from the ZO world, it goes on over top of the daily power defense, but it's water-based. It quickly gets absorbed. I was chatting with my trainer, and I know this doesn't come from ZO, but because it's water-based and goes in so quickly, you can put it on first. So I like to put that firming serum that I spent $330 on. I want that to penetrate my skin before anything else. So you're gonna see it here because I can't leave any info saying that it's the wrong order, but if you wanted to put firming serum right after the GSR, there's no issue with that, okay? Because daily power defense is water-based, pore refiner is water-based, so it doesn't matter, and it's a thinner texture. I'll let you feel the firming serum, because I saw you advertising it right up at the front. You've never touched and felt it before. You'll see how thin it is. It's really cool. It's got these little blue and clear dots on it. I don't know if you see those cool little dots. So it's really, really quickly absorbed into the skin. This targets something called your dermal epidermal junction, and that's responsible for all the anchoring fibrils in your skin for structural support. We've just added a component of firming serum into the new wrinkle and texture repair so that we're not only addressing the dermis, but that dermal epidermal junction to lift plus tighten sagging skin. Little bit like shapewear for your face. Spanx for the face, okay? But I just wanted to mention that because you saw it there. That's one exception that, yes, that's technically where a ZO would put it, but the firming serum could go on right after the GSR if you want.
It helps tighten the skin.
Tightens the skin, you betcha. I think they said 97% of the patients noticed a significant improvement in firming after 12 weeks, and 93% of the patients noticed a significant improvement in jawline skin sagging, because that's where we did the clinical, was from the temple down to the jawline. And for women in particular, men too suffer from this. As we get older, we, the skin, gravity is always a pull-in, so the skin loses elasticity, but your fat pads tend to separate. So we see tear trough, nasal, marionette, jowl. So that defined jawline is no longer defined. It kind of has the saggy sack there that starts to happen because the heavy weight of the cheeks fall, okay? So this is why we did the study on this area in particular, and 93% of the patients noticed a significant improvement in jawline skin sagging. So you know how everybody wants to do the big trend right now in injectables? Jawlines and chins. That's what everybody, the cheeks and lips have always been there, but the new areas to treat are the jawlines and chins. Have that really nice cut supermodel jawline, look really structured. This is right on trend, that firming serum, to support that. And if you guys do the Venus Legacy for skin tightening, this firming serum is a perfect complement. Can go all over the neck and the eyes. So you can it's been tested for the eye area like everything has. They're doing additional studies on the neck right now for it. But if you're doing skin tightening with that Venus Legacy, this is the perfect complement without any irritation. That's what I like. You can already be on your aggressive retinols and throw this into the mix and it's not going to add more.
Can it be used with places other than the face? Have somebody gets cool sculpting and now they lost some fat and the skin sags a bit.
Well, we haven't tested it there, so can it be? Sure. That tissue on down there is quite thick compared to like a thinner skin on the face. It's not like you can't. I just have no studies to support that. Yes, it's been clinically proven to do this there because we haven't done it there. Could it be used? Sure. Yep. But yeah, I know with cool sculpting, you lose the inches, but the sag starts to happen because there's that inch loss.
So you lose the fat, but the skin is now becomes loose. Yeah.
So I don't see why you couldn't. 100% you could. We just don't have studies on it to support it, unfortunately.
Yep.
But I just wanted to kind of show you what so for brightening, you're going to see a mild, a moderate, and a severe approach. So use this little cheat sheet because your one booklet's going to give you the info on the product. But this will tell you how to treat your patient. What's in front of you? Is it a mature patient that has anti-aging? Is it more mild aging? Is it more moderate? Oh, it's severe. It'll list what to do AM and PM, okay? And same with brightening, and same for acne, and same for rosacea. If you guys turn the page, I want to just show you something. Under acne and rosacea, I just want to clarify because I've abbreviated some things and you're not going to know what they are. So if you look under mild acne regime, you're going to see GSR, so cleanse, exfoliate, scrub, but what I'm going to talk about more the gentle cleanser because it's a mild acne, and probably the complexion renewal pads, the polish, that gentler, that's what the CRP stands for, is complexion renewal pad. Whereas if you look at the moderate approach, we're still doing a GSR, of course, but now we're going to do the exfoliating cleanser with the polish, but now the acne treatment pads. You see ATP for acne treatment pad. Severe option, GSR, but with exfoliating cleanser, acne treatment pad, and now we're going to do that dual action scrub. So I just want to show you what those abbreviations stand for, because I'm going to walk away and forget to tell you that, and you're going to have no clue what I'm talking about. So it goes in sequential order of how you would apply it. Doesn't mean you have to do all those items, but if you are, that's where they would go in order. Does that make sense, you guys? Yeah. Okay. Absolutely. So I just wanted to quickly show you that. We'll leave one for Michelle. Did I give one to Michelle?
I think you did.
I did, Michelle? Okay, perfect.
And we can fill her in on those.
Yeah.
Perfect, perfect. And I'm also going to give you a cheat sheet on the firming serum before you go to Michelle. Where did that go? It's in here. Just because we're not going to get a chance to cover everything. So this gives the clinical information on the firming serum because it's not in your product workbooks. They only do the product workbooks twice a year, so they haven't updated it yet because we have new stuff coming. So we'll be in touch.
Absolutely.
We didn't get it all done. Maybe the next time we'll do, rosacea and acne. I'll get as much as I can done by 5:30, and then we'll call her quits and finish off. But that's maybe not a bad idea because now you can. There's a lot of information we just gave you. Now you can absorb it, maybe, and then next time if you do it all at once, it's very. What was what again? Yeah, overwhelming. So I like to kind of break it up anyway. So hopefully you guys are okay with that.
Absolutely.
Okay.
Yeah, definitely.
Perfect. Well, thanks for coming.
Thank you very much.
Nice to meet you. Okay, so I'm just gonna tuck this back in here. All right. So let's continue with hydroquinone now, because we can at least cross this off our list. There's a lot of rules with hydroquinone. It's exhausting. I actually don't like talking about it because it's such an effort. So first and foremost, we got some name changing to correct on your papers. So do you guys mind, where it says Melamin on top, cross it off and put pigment control 2%. It's no longer a 4%, it's a 2%. So
Where am I looking?
yeah, swap that over one more page. This guy, you're on that page. Yes.
Hydroquinone.
Yes. 4% hydroquinone is no longer available in Canada. Happened as of July last year.
So Melamin C we don't have.
Cross Melamin C out altogether, we don't carry that. So Melamin, so where it says Melamin on top, put pigment control, 2%. Also put bleaching agent. I'm going to talk about these as bleaching agents and blending agents to make it more relevant for us. Also on top, put AM and PM, twice daily, application. Okay, now in the middle, cross off that middle one called Melamin C, but at the bottom where it says Melamix, put blending agent, put PM only, put needs to be mixed with 0.5 retinol or retinoic acid. Doesn't always have to be 0.5, but we use the wrinkle and texture repair because it goes dermal and melasma goes deep. Okay, so this is called Pigment Control Plus Blending 2%. Sorry, I forgot to give you the new name. So Melamix, the new name for Melamix is called Pigment Control Plus Blending, but it's a blending agent. I'm going to explain all this.